So in this tutorial, we're going to now visualize the specific antibiotics that are going to target those different classes of microorganisms. Now we said that you can divide the microorganism first into the gram stain. Let's visualize for the gram stain. For the gram stains, you generally have to know that in the gram stain, what is going to tag the gram stain was divided into the gram positive and the gram negative. You generally have to know that gram positive microorganisms are generally going to be targeted by penicillins family. Basically, penicillins family generally target the gram positive microorganisms. So when you're under the penicillins family, it's generally going to, so these are the antibiotics that are going to, it's not specific in this case, it is just antibiotic based on those different classification according to SchrDbb. So the gram positive are generally going to be targeted by the penicillin. So if you have a normal flora, you think of any microorganism as is gram positive as being a causative agent of an infection, you give penicillins. Now, you need to also know that apart from the penicillins, it can also be targeted by the next one, which are first and second generation cephalosporins. Basically, the first and second generation cephalosporins are more going to target still the gram positive. Basically, so the gram positive are going to be targeted by the penicillins, are going to be targeted by the first and second generation cephalosporins generally. Basically, so those are the general antibiotic based on the general. This is the classification of general antibiotics based on the classifications of the microorganisms according to the SchrDbb. Now, for the gram negative microorganisms, the gram-negative microorganisms are majorly going to be targeted now by instead the third generation and the fourth generation cephalosporins. Basically, you're going to have the third generation and the fourth generation cephalosporins that are going to target the gram-negative microorganisms. So when you're thinking of gram-negative microorganisms, give third generation or fourth generation cephalosporins. Now, the next thing that can target, but is not strong as the third and the fourth generation cephalosporin that you can give in gram-negative cases, is the cases of the sulfamethoxazole and trimethoprim. Sulfamethoxazole, trimethoprim. Sulfamethoxazole, trimethoprim can also is a small antibiotic which can target gram-negative microorganism peculiarly. So when you are thinking of gram-negative microorganism peculiarly, use sulfamethoxazole, trimethoprim, which is also called Cotrim or Bactrim. Basically, it is used peculiarly for gram-negative microorganism. Basically, now the next thing is when you have classification of aerobes and anaerobes. Is it clear? So among the gram positive and the gram negative, is it clear? You also had aerobes and anaerobes. Are you understanding? Generally, aerobes are going to be targeted by penicillins. So if you have a gram positive aerobe, you can give penicillins. If you have a gram negative aerobe, we can still give penicillins. Are you understanding? So when you have aerobes are generally going to be targeted by penicillins. Is it clear? Though they are gram positive or gram negative, their gram positive factor make that they are targeted by penicillins and the first and second generation cephalosporins, and the gram negative factor make them to be targeted by the third and fourth generation cephalosporins and sulfamethoxazole, trimethoprim. But you need to know that the aerobic factor make it to be targeted by penicillin. So gram positive aerobes are going to be targeted by penicillin. Also gram negative aerobes are going to be targeted by penicillins. Are you understanding? The next one you are going to have, and also when you are aerobe, apart from penicillin, you can also be targeted by macrolides. Is it clear? When you are aerobe, is it clear? So when you are aerobe, you can also, apart from penicillin, you can also be targeted by macrolides when you are particularly aerobe. That is why penicillins the macrolides are the major medication that are going to be an altered medication for penicillins when you have an allergy. Is it clear? And you have different examples of macrolide that I'm going to explain to you. Now, in the next case is anaerobes. Generally, their anaerobic action make you to be targeted by the nitroimidazoles. Is it clear? An example of nitroimidazoles, you have metronidazole, metronidazole, metronidazole. You are going to have secnidazole, secnidazole, and you also have the next one. You have metronidazole, secnidazole, you have tinidazole. Now, also, anaerobes can also be targeted by linezolid. Linezolid. Is it clear? Anaerobes can also be targeted by linezolids. So, if you have a patient, a microorganism, you are thinking of aerobe, give penicillins or macrolide. If you think of anaerobe, you give of nitroimidazole or linezolids. Is it clear? So those are generally on the gram stain. That is what is going to be given. General antibiotic